Shoulder pain is such a common problem that it affects 2 out of every 10 people. And if you're watching this video, probably you might also be experiencing this problem. And I'm here to help you solve it and say goodbye to your shoulder pain. There are several causes for someone to have shoulder pain. The most common are the well-known bursitis and tendinitis, often caused by repetitive strain. I myself had this shoulder pain problem when I was 16, and I consulted several doctors, several physical therapists, and no one could help me solve this problem. I can't take it. It was an indescribable pain, and this pain I had in my left shoulder was one of the inspirations I had to choose my profession. I thought to myself, you know what? I'm gonna solve this myself, and I will solve it. Today, for example, I no longer have that pain that bothered me so much. And how did I manage to solve this? With the exercises I'm going to show you in this video. I am Dr. Kelvin. This video I'm going to show you the 5 best exercises that I use to resolve my shoulder pain. These exercises are simple, easy, and you can do them at home. But you need to stay until the end of this video because these exercises are step by step. You need to do all of them. So I prepared this video with a lot of care. I ask you to leave your like, subscribe to the channel, and share this video with someone who is also suffering from a problem with shoulder pain, that you can also help this person. And before I show you these educational exercises, I will explain to you what probably no one has explained to you until now. I will show you what your shoulder looks like inside, so that it makes sense to you, these exercises, because you will learn exactly which muscles will be strengthened to improve your shoulder pain. In this video here, for example, you are seeing the innermost muscles of the shoulder, those that are inserted within the joint. This muscle group is called the rotator cuff. Cuff because it resembles a shirt sleeve. It is inserted here in the shoulder. And rotator because it performs rotational movements, external rotation, rotation outward, and internal rotation, rotation inward. Therefore, this muscle group is called the rotator cuff. But besides performing shoulder rotation movements, this muscle group has a very important function, which is to provide stability to the shoulder. They are stabilizing muscles. Therefore, when these muscles are weakened, we have a painful and weak shoulder because this shoulder lacks stability. This info is very important so that the exercises for shoulder pain make sense. And many patients do not receive this information in the office. So comment below for me if you already knew this or not. I read all the comments you leave here on the channel, and many of these comments can become future videos. Leave a comment for me below. I won't give you the names of all the muscles that make up the cuff, and there are other muscles that help form the shoulder, but one you need to know. I cannot mention this muscle. It is the supraspinatus muscle. This muscle is the champion in the office for patients who have some tendinitis, some tendinopathy, some degeneration. Tendinitis, then, is an inflammation of the tendon. Now, when this tendinitis is not treated, is not taken care of, when the causative factors that produce this tendinitis are not reduced from the patient's lifestyle habits, like repetitive strain, for example. When tendinitis is not treated, it progresses, and it progresses to tendinopathy, which is a little more serious. Tendinopathy is a degeneration of the tendon. Besides the supraspinatus tendon, we also have several bursae in the shoulder. And these bursae are like sacs, or little cushions that also serve to protect tendons, ligaments, protect the joint. However, when these bursae are inflamed, also due to repetitive strain and the like injuries, then we have a problem that you know, that you've heard of. Maybe it's in the report of your exam, which is the famous bursitis. Bursitis is the inflammation of the bursa. This also worsens a lot when person has shoulder pain due to inflammation in these structures that I just mentioned to you. You might be feeling pain when doing certain movements, like this one here, for example. Look, which mimics even a famous orthopedic test to diagnose impingement in the shoulder. We call this test the Hawkins-Kennedy. You might also feel pain when doing movements to raise the shoulder up, a shoulder flexion, exercises to open the shoulder, and abduction. exercises of external and internal rotations, difficulties in putting on a coat, difficulties in combing your hair. So all of these can be difficult movements for a person to do if they have these problems. The rotator cuff is one of the muscle groups that we have here in the shoulder that I will teach you how to strengthen. I will teach it in exercise number 4, strengthening the rotator cuff. But we have several others, so don't forget to leave your comment down below. I read all of them and stay until the end of the video, so for you to receive all these exercises that will help you. Exercise number 1. For this exercise, you will position your hands, for example, on the window of your house. A support structure can be a stool, like the one I'm demonstrating in the video. And what you're going to do now is you're going to apply force, pushing this support structure you're holding towards the floor. And you're going to direct your hips backward. And you're going to do this about 15 repetitions. So direct your hips backward. Return, count 1 repetition. Direct it again. Don't lose the hands force. Hold it there, pushing your support backward. And return, count 2 repetitions. Move your hips backward. Return forward. Count 3 repetitions. And when I do this exercise, I feel an almost immediate decompression, a relief in my shoulder pain. Exercise number 2. So for this exercise that I'm going to show you now, the first thing you need to do, look, is puff out your chest and rotate your shoulder backward. Puff out your chest here and rotate your shoulder backward. I'm almost certain that you who have shoulder pain and are watching this video, you must have your shoulder more forward, a more retracted posture. This increases the impact here on the shoulder, worsens all the shoulder pain factors. So give your shoulder a little rotation, move it backward, and puff out your chest. That's how you're going to start the exercise. Now, without losing this position, you're going to look for a door frame in your house and stretch your chest. So place one arm on each side of the door frame and move your torso forward. Then remain in this position for 60 seconds. And when you finish this exercise, keep your shoulder rotated back, improving your posture. Then do 3 sets of 60 seconds, because I am almost certain that one of the biggest culprits for your shoulder pain is, here look, a retracted posture, a forward posture. When you stretch the chest, which is the muscle pulling your shoulder forward. When you stretch here, you can achieve decompression in your shoulder, improving your pain. Exercise number 3. For the third exercise then, that you will need to do, you will slowly kneel on the floor and get into a position, look, on all fours. And for the first part of the exercise, you will do the following. Look, without bending your elbows, elbows straight. You bring your torso closer to the floor and you will feel the space between your 2 shoulder blades decrease. Doing this, look, without bending your elbows. In the second part, you push the floor. Now you move your torso towards the ceiling. Feeling. So the space between the 2 shoulder blades now increases. And again, I will remind you, do this exercise without bending your elbows. For this exercise, you will be doing a strengthening of the serratus anterior muscle. This muscle is an important scapular stabilizer. By strengthening it, you also improve the stabilization of your shoulder, reducing your shoulder pain. This exercise can then be done in 3 sets of 12 repetitions. A variation of this exercise that I just taught for those who can't kneel on the floor is to do exercise standing with a flexible ball of any size. And then you push the ball against the wall. But pay attention, it's not the torso that moves forward or backward. This time, look, it's the arms. It's just the shoulder here that moves forward and backward, and not the torso. Exercise number 4. For exercise number 4, some muscles will be strengthened. Some muscles of the rotator cuff. Those that perform external rotation, and they are major stabilizers of the shoulder. So strengthening these muscles ensures stable and pain-free shoulders. For this, you should have a band like this. It can be found in stores that sell medical or sports products. And you also need to find a place at home to attach this band. It's important that it is secured at a height that is level with your navel. You can position a cushion or mat between your shoulders. Form this exercise safety shoulder. Then you pull band from the direction of the navel outward and beyond to the stars, exactly like I'm doing. The contraction should then be maintained for 5 seconds to engage the fibers responsible for shoulder stability, and the movement should be repeated in 3 sets of 8 repetitions for each side. The exercises can also be done in internal rotation, that is, starting from the outside to the inside as well. 3 sets of 8 repetitions for each side, and taking advantage of the band, we then have the exercise number 5. For exercise number 5, you will perform a shoulder abduction, then pull the band upward. Hold for 5 seconds, and then eventually return later as well. 3 sets of 8 repetitions with 5 seconds of muscle contraction. This is an excellent exercise to strengthen some of the muscles in your shoulder. These are exercises for muscles that, if they are weakened, the shoulder pain will be even greater. Now that you have learned these exercises, don't forget, this video was made for educational purposes. It does not replace a consultation with a specialist, but it serves to help many people. So spread this video like a chain of good to other people you know who have shoulder pain. Save this video for yourself and come back to this video often so you can keep repeating these exercises, because it's not just once. Just one set of exercises that will work miracles on the shoulder. They need to be done consistently and with discipline. I recorded another video where I literally laid down on the bed and showed what are the 3 ways a person should not sleep, because it will worsen shoulder pain. You'll wake up at night with shoulder ache, and I showed in practice then how to position the pillows, other variations for sleeping if you have shoulder pain. To watch this video, click here and you will be directed to that video. And thank you very much for staying until the end. See you next time. Bye.